Hello, I'm Jo from Specialist Language Courses. We are OET premium preparation providers, which means we are experienced and skilled in what we do, helping people achieve success in the OET exam. So in this video, we're going to look at OET writing and how to approach the writing exam. We will look at what to expect in the OET exam, how you will be assessed, how to approach the writing paper, what types of letters you might write, and how to select and organise the relevant information. So in the writing paper, you're given 5 minutes reading time, and you're not allowed to write in this time, and then you have 40 minutes to write. You are always given a set of case notes, and you need to write a letter. You will always write as your profession. So if you're a nurse, you're writing as a nurse in the exam, and you could be writing to another nurse or perhaps another healthcare profession. And if you're a doctor, you usually write to another doctor or perhaps a specialist such as a neurologist or cardiologist. So in the exam, you are assessed on 6 criteria: purpose, content, conciseness and clarity, genre and style, organisation and layout, and language. Purpose is always out of 3 marks, and the others get a maximum of 7. If you'd like more information about the criteria, please click here. So how should you approach the writing paper? Here are some steps you can follow. Step 1, you should read the case notes and find out who you are writing to, and most importantly, why. Step 2, decide what information is relevant and what information the reader does not need to know. Step 3, make a plan. Decide on the logical way to group the relevant information together in paragraphs. Step 4 is write your letter. Use clear language to summarize the important information and leave a line between paragraphs. And step 5 is check your letter. Check your letter for errors and make sure you have included the key information. So, what type of letter will you be writing? In the OET exam, you might write a referral letter, a discharge letter, or perhaps a transfer letter. The most common ones are referral letters, but it's important to work out which type of letter you are writing and to who. So for nursing, there are many different people you might write to. The most common is another nurse, such as a community nurse, or you might write to another healthcare professional, such as an occupational therapist, physiotherapist, or maybe even a GP. So in medicine, you might be writing as a GP to a specialist, for example, neurologist, cardiologist, gastroenterologist, or you might be writing as a specialist to the GP. Or you might be writing, like in nursing, to another healthcare professional, such as a dietitian, occupational therapist, or a physiotherapist. So it's really, really important that you know who you're writing to. Reader awareness is key. Knowing who you're writing to will affect the information you're going to select. For example, a social worker won't need information about medication, and a physiotherapist will probably only want information relating to mobility and physiotherapy sessions. They won't want information about wound care. So how do you decide what information to include? It's important to analyse the case notes. One option is to use guiding questions. For example, who are you and who are you writing to? Why are you writing? What is the purpose of the letter? What information is important to include, the essential key information, and what information is not relevant to the purpose of this letter? Option 2 is use a tool such as ISBAR. ISBAR stands for identify the patient's name, age, and how they're connected to you. For example, they've been a patient in your care. Situation is why you are writing about this person. For example, to transfer a patient into the care of another facility. It's an overview of their health status and any other relevant information such as admission dates. Background, any relevant parts of the patient's medical history and social or family background. Assessment, how is the patient now and what treatment are they receiving? recommendation or request. What do you want the other person to do? For example, monitor their diet, refer to the occupational therapist, and any other information they need to know for ongoing care. The most important thing when selecting relevant information is who you are writing to and the purpose of the letter. For more help on identifying and writing the purpose in OET letters, check out this video. How should you organise the information? So once you've decided on the relevant information to include, you need to make a plan and think about how you're going to organise that information. It should be clear and logical. You need to write in clear paragraphs and leave a space between each one. Key information needs to be highlighted so that important information is easy to find by the reader. You can connect your ideas together using some linking expressions, but don't overdo it. And don't use formal academic linkers like moreover. How should you check your letter? So when you finish writing, it's important to try and leave some time to check your letter. Make sure you have made the purpose clear. All key information is included, especially any action you want the reader to take. You have not included any irrelevancies. You have written in clear paragraphs, and you've used clear and accurate language. Top tips for OET writing. Approach each task individually. You need to be flexible and adapt to each case. Always keep in mind the reader and the purpose of the letter. Make sure each letter focuses on the most important information. Plan your letter and leave time to check your letter. So thanks for watching. For more tips and strategies on the OET exam, check out our website, link below. Please like and share with your friends so we can help more people achieve success in the OET exam. Don't forget to subscribe for more videos like this. Bye!